With the flu season still bad, many people are taking a quick test to find out if they have it. But according to the Centers for Disease Control, the results can be dangerously misleading. Here's Omar Villafranca.
24-year-old Dominic Sy doesn't feel well.
Just relax.
And came to this emergency room to get a rapid flu test.
It was a bit uncomfortable because the swab itself just went really deep into the throat.
The test requires a swab to go deep into the nasal cavity for a proper sample. But the results, back in around 5 minutes, can produce false negatives, telling a patient who has the flu that they don't. The CDC says the quick tests are only 50 to 70% accurate, but are the most common flu tests performed at hospitals and clinics during flu season. Last week, 15-year-old Kira Molina went to a suburban Atlanta clinic when she wasn't feeling well. Her flu test came back negative. A few days later, the teenager died of liver complications from the virus. Dr. Cedric Spock is an infectious diseases doctor at Baylor Scott & White in Fort Worth.
This is a test that can be easily done in the office as what they call a point of care test, so you can get the results quickly at the exact time that you tested.
A few minutes.
A few minutes, correct.
Some patients elect for a comprehensive lab test, which takes longer to complete and is more accurate. But even if a rapid test comes back negative, Dr. Spock says healthcare professionals are trained to treat symptoms.
Looks like a duck, quacks like a duck, it's got to be a duck. I may not prove that it's a duck. So somebody comes in, fevers, aches, a lot of people sick in the house or at the school, it sounds like the flu. We know the flu is everywhere, it's the flu.
The difference in cost for the two tests can be a factor for patients. That rapid test costs anywhere between $5 and $10, but the lab test can cost more than $200. Jeff?
Wow, Omar Villafranca, thank you very much.